And now we're going to hear from an actual physician. How about that in the health sector? EyeScribes.
Thank you. I'm very humbled to be up here, honored to share the stage with so many great people, so many great companies. My name is Jared Pello, and I know that in the crowd we have lots of distinguished professionals from great careers, entrepreneurs, investors, attorneys, just to name a few. I want you to think about your typical day. How many times a day do you interact with others? Meetings, conversations, phone calls. Now think about all of those. What if you had to sit down at a computer and type up a detailed note after each and every one of those, no matter how mundane? Now imagine complex, ambiguous rules dictating the contents of that note. If you leave some detail out, you might not get paid. If you don't accurately document, there could be a devastating lawsuit that could ruin your life. How much added stress would you have in your life? Would you start questioning your career, even think about quitting? Well, welcome to the world of modern medicine. When I started down the road of medicine years ago, I wanted to help people. I truly believe that most physicians want to help people. That's why I found it so curious that 90% of doctors, when I was in college, they told me not to become a doctor. I couldn't understand why they were so jaded. I promised myself I'd never end up like them. And I remember my first patient in medical school, and I felt like a real doctor. It was so cool. I went and saw him, and then I went to write the medical record, the note needed after every patient visit, and it took me 2.5 hours. And I was angry, and I was mad, and I started to feel that pain that physicians feel. And physicians are very angry about the documentation burden, especially with the electronic medical record. In fact, in a recent survey, greater than half of physicians say they would change professions if they could, and if they could go back and make that decision again. And this is cited as the #1 reason why: documentation and interacting with the electronic medical record. Now, things changed for me with one simple decision: where I went to residency. I ended up going to the University of Virginia in 2008, an important year because it was the year they began their medical scribe program. Now, medical scribes, they're miraculous. They are angels. Well, okay, really they're pre-med students, and they're taught to document like a doctor. But for physicians who spend 40% of their time stuck on a computer, they can be life-changing. They follow the physician around and write up the note just as if the physician had written it. And focus is placed back on the patient and the physician, and patients are happy, and quality of care is much better. Now, medical scribes became so important to the way I practice medicine, I wouldn't even interview anywhere they didn't have a medical scribe program. And I ended up in Lynchburg, Virginia. And I had a medical scribe by my side, and I saw a lot of patients. And that changed when they sent me to Farmville to run the emergency department there, Farmville, Virginia, and I didn't have a medical scribe, and it drove me crazy. And for the first time in 5 years, I felt the full crush of the documentation burden, and I hated it. And I saw patients who had been waiting in the waiting room for 4 hours in pain, with fevers, serious medical conditions. And I would look around my emergency department, my waiting room stayed full, and my colleagues were stuck on their computers. So I started looking for a solution. There had to be a way to fix this. And first I found Google Glass, and I thought, this is it. I can wear this, my scribes in Lynchburg can document for me. But it wasn't quite right. And that was the genesis of EyeScribes. And since we've begun working on this problem, we realize how enormous it is. So think about these numbers: $600 billion paid to physicians. With 40% of their time spent on a computer, this is likely greater than $100 billion waste, $100 billion inefficiency. Now, the logic behind our business is simple. Doctors should be as efficient as possible, but they're limited by the documentation burden. Medical scribes, great solution, but they can't answer the call. They can't scale to the enormity of this problem. Technology can help scribes scale. Eventually, it will replace them. Now, we've been busy. We've been at it for 8 months. We're currently in 3 clinics. We have recorded and documented thousands of patient interactions, and physicians call our system amazing and life-changing. And I'm very excited to announce we started our seed round yesterday with our first users investing. Triangle Orthopedics put in $100,000 yesterday. We are EyeScribes, and we are solving the biggest pain point for physicians in making patients' lives better. And lastly, think of this with me. Medical scribes make physicians at least 25% more efficient. If we can spread that efficiency across the board, it's as if we have added 200,000 physicians to the workforce. We don't really have a physician shortage. We have a physician misuse. We are looking for investors that can come on board and be passionate about this with us. We're also looking for connections to healthcare systems and looking for people that want to join our team. Thank you.
So you mentioned Google Glass.
Yeah.
Are you still not, are you using that still, or?
So honestly, we have a Glass app that is killer. It's one of the best, and other companies have raised $10 million with similar apps. But we wanted to fix the problem now, so we use a mobile app with a smartwatch. And it's stable, and it's really simple, and doctors can even use it.
So, and Howard, tell me more about the price model.
Yeah, so our price model, right now we have 2 different customers. There's these scribe staffing companies, and there's a huge part of the market they can't reach, and we allow them to reach everybody. And so we charge them $1 per visit, $1 for each visit they document. Now there's 1.2 billion visits, outpatient visits in the US each year. Now, if we provide our own scribes, we charge $5 per visit. And then we also, currently, our other customers are people that have their own scribes, and we'll just make their scribes more efficient. So if they have their own scribes, they're having trouble scheduling them, or they want to have 1 scribe taking care of 3 doctors, we make that possible.
Thank you very much. I appreciate it.
Thank you.